Welcome to the UK Centre on Trauma in Children's live Facebook launch event for the Secondary Traumatic Stress Innovations and Solutions Centre. Today, Dr. Jessica Esslinger from the UK Centre on Trauma in Children will interview members of this new centre and give audience members a chance to ask questions in the live chat. And now, Dr. Jessica Esslinger.
Hi, everybody. On April 30th of this year, the University of Kentucky Center on Trauma in Children was awarded a 5-year, $3 million grant by the Substance Abuse and Mental Health Services Administration in support of the Secondary Traumatic Stress Innovations and Solutions Center. This grant is a part of the National Child Traumatic Stress Initiative and will extend over 5 years. I would like to introduce you to the STS-ISC team who will provide us with more information about this project. Dr. Jenny Sprang is a professor of psychiatry at the University of Kentucky College of Medicine and is the executive director of the UK Center on Trauma in Children. She is a systems change and secondary traumatic stress expert and chair emeritus of the Secondary Traumatic Stress Committee of the National Child Traumatic Stress Network, also known as the NCTSN. Dr. Sprang is the principal investigator of this new Category 2 grant, as well as the PI for the Child and Adolescent Trauma Treatment and Training Institute at the UK Center on Trauma in Children. Dr. Sprang is joined by several members of the grant team, including Dr. Leslie Ross, who is the director of the NCTSN core curriculum on child trauma implementation, and a staff member of the National Center for Child Traumatic Stress at UCLA. She is also a chair emeritus of the NCTSN STS Collaborative Work Group and is considered an expert on secondary traumatic stress. Allison Hendricks, licensed clinical social worker, is a training and consultant who specializes in secondary traumatic stress, trauma-informed systems, and trauma-focused cognitive behavioral therapy. She is an affiliate member of the NCTSN and is the current co-chair of the NCTSN STS Collaborative Work Group. We're also joined by Cambria Walsh, licensed clinical social worker, who is an individual affiliate and former co-director of a Category 2 center in the NCTSN. She is a co-author of the guidance document, Secondary Traumatic Stress and Child Welfare, Trauma-Informed Guidelines for Organizations, and she is an expert on secondary trauma and systems change. Welcome to all of you. Let's begin. So Dr. Sprang, can you tell us what this grant is all about?
Well, if you logged on to our launch today, you probably know a little something about secondary traumatic stress, or we'll call it STS. But if you're newer to the topic, this is really a condition that comes as a result of repeated and extreme exposure to indirect trauma. So this might happen if you're in a position where you're hearing graphic details of another person's trauma over and over, when you have to repeat these stories in court, or if you see and hear trauma details from other people that you're working with. Sometimes it's very mild, but it can also be a really serious condition that looks like PTSD in its most extreme form. So this SAMHSA grant is really going to allow us to launch this National Center of Excellence on Secondary Traumatic Stress Prevention and Intervention. And we are really happy to continue our work in this area as part of the National Child Traumatic Stress Network. So what we'll be doing is creating a living laboratory where we're going to develop, implement, and test methods to decrease trauma symptoms in workers and help them function better. So we really believe that as professional well-being increases, that workforce indicators like absenteeism and presenteeism and attrition from the workforce will decrease, and that the quality of care that we can provide to other people will improve.
This sounds great. What will you be doing to make this happen?
Well, we've got 4 goals that are facilitating our work, and I'll tell you about the first one. This is really helping organizations become more STS informed. And we're using a data-driven organizational change approach to do this. So what this means is that we're using measurement tools that we've developed to guide organizations towards being more responsive towards secondary traumatic stress and helping them, support and create resiliency in their workers. So we'll be tracking organizations and individual workers over time so we can find out if the strategies that we're developing and using are making these organizations more STS formed and the workers less distressed.
Thank you. Allison, I understand the grant is specifically targeting supervisors. Can you tell us about this work?
Sure. Well, we know that supervisors play a vital role in supporting staff and to help them manage their reactions to work-related trauma. However, supervisors are rarely trained in STS, and many feel ill-equipped to respond and to help workers when they're dealing with secondary trauma responses. A lot of supervisors want to help their supervisees, but they may not know how or what to do. Mm-hmm. Supervisors also have to answer to administrators and agency demands, and oftentimes get pressure to make sure staff are meeting their requirements. This can create conflict for supervisors when they see that agency demands and high trauma caseloads may be contributing to distress in their supervisees. Supervisors can also experience their own STS as they are being exposed indirectly to the trauma of their workers' cases, as well as feeling responsible for the outcomes of those cases. Dealing with all of this, supervisors oftentimes lack support. So they're trying to deal with all of this without a lot of support, either from peers or their agency managers. So what can we do to help supervisors so that they can better support frontline workers? Our center will be focusing on supervisors as key change agents, and we'll be using the NCTSN's core competencies for secondary trauma-informed supervision. We're creating an implementation guide for these core competencies so that supervisors will better know how to use the core competencies and a self-rating tool to kind of measure their own competency and progress across a couple different domains. And then we're also developing training modules for each of the 9 competencies. And these training modules will include very specific practices that supervisors can do to help their workers. Our goal is to train 240 supervisors using these tools and utilizing a self-rating tool to help measure their progress across the competencies. So we'll see if the training is helping them to become more STS competent. We're offering this training to supervisors across NCTSN sites, but also to other child-serving agencies and providers. We really want to have a special focus on supervisors from underrepresented groups or in areas such as border, tribal, and low-resource areas. The training and implementation guide will also be available for anyone to use and will be widely disseminated throughout the NCTSN and other national and local child-serving agencies.
Thank you so much, Allison. Dr. Ross, it seems like this grant is building off of the work of the NCTSN in many ways. Can you tell us a little bit about that?
Yes, Jessica. I think that the National Center for Child Traumatic Stress, or NCTSN, has been well known in 2 areas in particular. One is excellence in providing training, and the other is developing interventions. So we're going to be focusing on these 2 main areas. The first will be developing and building a training for providers to address secondary traumatic stress. The NCTSN Secondary Traumatic Stress Collaborative Group has developed a more basic training on secondary traumatic stress that really provides an excellent overview of what it is and how it might impact you and what some of those experiences might be. That's available already. And building on that work, we want to expand and really look at a more advanced training that looks at applying some of that knowledge. So we really want to help people be able to assess what's going on for them. It's a very complex experience, and there are many, many factors involved. And so it's important for people to be able to get a better sense of what's going on with them, and then also to apply strategies to address it. So we want to develop this more advanced training that will help providers in that way. The second area that we're going to be expanding and developing on is designing and creating a model of intervention. So we want to be sure that we are using a research base to develop a model to provide an intervention for people who are experiencing some of the more severe symptoms related to indirect trauma that, as Dr. Sprang mentioned earlier, are sometimes very similar to PTSD symptoms. So our goal is to train 20 providers or interventionists across the country that will be able to not only provide this new intervention, but also help us create a research base to really document that it is going to support people in the best way possible.
Thank you so much for that information. Dr. Sprang, are there any special groups or populations you're targeting?
Yes, so we are really wanting to be very inclusive and include, organizations, individuals, and teams from all over the country. But we really want to make sure that we're getting to those, professional groups that are underserved and under-resourced. These might be people that are working in really high stress, high exposure situations, and may have little access to some of the funding that comes with working in a bigger agency. So this, like Allison mentioned, could be professionals that are working in border states with unaccompanied minors or children that have been separated from their parents, professionals working with really historically marginalized groups, and also with foster and resource parents who we've discovered have a really high need for inclusion in a project like this.
Thank you. Cambria, Dr. Sprang mentioned specifically targeting resource parents in this project. Can you tell us why and how you hope to accomplish this?
A great question, Jessica. Thank you. Yeah, most of the work that's really been done to date has been done really looking at organizations and not looking at resource parents. There's not a lot of information out there, though. Our center did do some recent research that looked at resource parents, specifically at foster parents, kinship care parents, and respite parents. And we were surprised, frankly, by the level of distress that this particular group was experiencing. Although logically, when we think about it and we think about the children that they're working with, who are children who are in the child welfare system that often have high levels of trauma, logically it makes a lot of sense that this particular population would be impacted by the trauma stories that they're hearing, by the behaviors that are going on with the children who are in their care. And we know that the resource parents are really a critical support for the children and families that they're working with. And so, being exposed to the trauma symptoms, being exposed to the behaviors of the children in their care, they're really such an important part of the support. And we really want to look at how we can support them. So we're doing a couple of things to do that. One is that we are we've done a look at what resources are out there, and there's really not a lot of specific resources, but there is a resource parent curriculum that the National Child Traumatic Stress Network has developed. And so we're looking at creating a supplemental part to that training that will specifically focus on secondary trauma. It will focus on, some of the issues of self-care, but really going beyond that and looking at research-based strategies that will be helpful for resource parents in terms of being able to address this particular issue. We're going to work very closely with experts within the National Child Traumatic Stress Network and really include them in collaborating on working on this particular product. And once the training module is complete, then we're going to be delivering it to about 300 resource parents and really taking some time to evaluate its effectiveness.
That's great. This sounds like a comprehensive approach to addressing secondary traumatic stress. Let's talk about how people can get involved. Allison, who can benefit from these services?
Well, we're really trying to make them available and accessible to any provider or agency who's working with children and trauma and work-related trauma. So as we mentioned, NCTSN sites will be invited to participate, but we really are hoping to engage other child-serving agencies beyond the NCTSN who are dealing with a lot of secondary trauma. And we talked about a little bit about, the agency level engaging leaders. So leaders will be invited to participate perhaps in one of the Breakthrough Series collaboratives, and also just being able to use that organizational change package that will be available for anyone to use. For the supervisors, as we mentioned, the training on the core competencies for STS-informed supervision will be available, as well as the implementation guide for the self-rating tool so that they can know how to use that and how to assess their own progress across those competencies. For frontline providers, we're really looking at that advanced training, and then also for the resource parents, and people who train resource parents, looking at that STS module that Cambria was mentioning, and also wanting them to access the other resources on our site, including the advanced STS training. So basically, anyone working with children exposed to trauma can benefit from the products and services that we're developing.
Great. Cambria, how can organizational leaders who are interested in being part of an STS Breakthrough Series collaborative get involved?
So we're recruiting organizations of any size to participate, as long as they can put together a team or teams that are available to participate in the Breakthrough Series collaborative. They can be from a lot of different backgrounds. We could look at child welfare organizations, mental health organizations, those working in education, healthcare, juvenile justice, multidisciplinary organizations as well. The focus is really going to be on having regional BSCs. However, we know that, in current times that people are not traveling and they're not gathering. And so we're also really looking at ways to hold those breakthrough series virtually as well. So we are learning on the fly, as everyone is, about how to do things virtually. And there's a lot of information that's going to be coming available on the website. You can see the website address on your screen right now. And if you go to that, there's actually a link that you can click on to show that you have some interest in learning some more about this particular piece. So we are definitely recruiting and looking for folks to join us throughout this progress on this project.
Great. And finally, Dr. Ross, how can people access materials?
Well, as Cambria was just mentioning, there are actually three main ways that you can access these materials. There's some materials for training that can be done virtually, that can be accessed on the website. And those trainings also will be designed so that you can use them for face-to-face trainings as well, once it's safe to do so. So those will be available as they're developed for anybody to access on the website. In addition to that, we'll also be posting many of these materials on the NCTSN website on the STS webpage there. So there are already a number of resources related to secondary traumatic stress available on the NCTSN website, and we'll be contributing to those as often as we can. So you can access them there as well. Some of those are just printed materials, but also there's going to be a variety of different kinds of training materials and resources that will be available. The third way is, of course, as has been discussed, is to sign up for some of the trainings that we're going to be offering and the Breakthrough Series Collaborative. So again, you can go to the website and you can look at the way to access those trainings and get more information. So those are the three main ways that you can take advantage of some of the resources that will be developed as part of this project.
Great. This is all great information. Thanks to the STS ISC team for telling us about this project, and thanks for all of you for participating in this live event.
Thank you for joining us for the launch of the Secondary Traumatic Stress Innovations and Solutions Center. If you're interested in learning how you can be part of the center's initiatives, follow the link on the screen or in the chat box. There is a contact form that you can complete on this webpage. Thank you so much.